year 2020 was very difficult for everybody in the world.
As we are all aware, the COVID pandemic, has put a lot of strain on communities, including young people and children.
"2020 was an eventful year for the Kenya Red Cross Society. A new Secretary General, Dr. Asha Mohammed, a new governance team, reorganization of its business, and a new strategic plan 2021 to 2025 was under development. Like every other organization globally, however, COVID-19 was the most significant event of the year.
Here we were trying to settle and found ourselves really having to already get into a very fast response mode.
In line with its auxiliary role to the government, Kenya Red Cross Society played a key role in the COVID-19 response both at national and county level.
We sat in the National COVID Response Task Force that was chaired by the Ministry of Health, and we were also members of various other subcommittees.
By the end of 2020, Kenya Red Cross had reached over 32 million Kenyans through sensitization activities, installed over 700,000 hand-washing facilities, distributed 600,000 hand sanitizers, and screened over 3 million people for COVID-related symptoms.
There was also the question of the social and economic impact. So we reached out and distributed food to many communities in the country through the support again of many Kenyans who came forward and partners, and also cash transfer.
Another 93,000 people were reached through direct cash transfers. Andrew Kilu and his family living in Majengo, Nairobi County got their share of food to keep them going during this uncertain period.
Manake chakula ilikuwa inapatikana vile, wanaweza patikana even once per day.
Under emergency food distribution, Kenya Red Cross reached over 600,000 people, 450,000 in informal settlements. Kenya Red Cross also targeted special population groups. For years, Kenya Red Cross has been supporting UNHCR in provision of health services in Dadaab and Kakuma refugee camps. During the pandemic, protecting refugees and host population became a priority.
In that station. And if it happens,
with our movement partner, the International Committee of the Red Cross, the Society supported prison authorities to make inmates and wardens safe from COVID-19. Under the Restoring Family Links services, the Society also helped over 50,000 inmates in 128 prisons to make free phone calls and connect with their loved ones following restrictions of movement in and out of the prisons. To address the growing threat on mental health, Kenya Red Cross deployed the 1199 line to provide tele-counseling to thousands of distressed Kenyans. Over 43,192 people, among them healthcare workers and young people, were reached directly with tele-counseling. The top cases dealt with were on stress, family and marital issues, relationship issues, depression, and anxiety. Kenya Red Cross also trained 500 healthcare workers in psychological first aid to provide emergency help to their colleagues at work. As COVID-19 continued to affect communities, Kenya had other major disasters in 2020. The year witnessed some of the worst flooding in recent years following heavy rains that started in late 2019 and continued through 2020. Over 40,000 households were displaced. The Society directly supported over 10,000 households through evacuation, search, rescue and recovery, distribution of food and non-food items, provision of temporary shelter, provision of health and hygiene services, permanent shelter reconstruction, among others. In West Pokot, 222 families displaced by a landslide that killed over 40 people were assisted to construct new homes.
Red Cross was called upon to do their role, that is our auxiliary role. And indeed, we assisted a lot of vulnerable people within the whole country.
Besides the major emergencies in the year, Kenya Red Cross continued implementing its development programs in disaster management, health, nutrition and social services, organizational development. In collaboration with the Ministry of Health to roll out community health system strengthening initiatives to complement the government's efforts towards universal health coverage, the highlights of which was a training of 28,780 new community health volunteers on the basic and technical modules of community health strategy. Another 59,833 existing volunteers were sensitized on universal health coverage, primary healthcare, and COVID-19. The community health volunteers continued to support their communities, household visits continued, expectant mothers were attended to in all corners of the country.
Alafu hata tunawea shukrani wa CFCs kwa sababu wametuelimisha, hasa at least tumekuwa na nini elimu kidogo, si kama wa kitambo.
Nimeweza kuwaeleza hasa wamama wajawazito wanafaa waweze kutembelea idara ya afya.
To mainstream non-communicable diseases during emergency, the Society worked with the Department of NCDs to develop training materials and standard operating procedures for healthcare workers and community health volunteers. These cover diabetes, hypertension, mental health disorders, injuries, and asthma. The Society continued to be the principal recipient for the Global Fund HIV grant. Through 73 local organizations and networks, the fund reached 460,000 people with much-needed HIV services. 2020 was also a year in which Kenya Red Cross embraced innovation and use of modern technology. The Society deployed drones in its flood response to support search and rescue as well as during the COVID-19 response.
So all these events really made us very quickly then try to come together quickly, try to mobilize especially our volunteers and staff and also our partners. And I'm really happy to say that we really appreciate that despite the pandemic, despite all the challenges that were going on, we really saw, great goodwill from even Kenyans who came to help in this response.
Though funding to long-term development programs decreased due to partners focusing on COVID-19, this did not deter the Society and its volunteers from working.
I think as an organization, we were able to integrate our interventions to be able to provide all the necessary services.
Kenya Red Cross Society owes its success in a difficult year to its army of committed volunteers, most of them young people. Throughout the year, the young men and women were in every corner of the Republic supporting communities in need and exemplified the Society's value proposition, always there. The Society has picked key lessons from 2020 and it plans to consolidate the gains from the difficult year and find ways to improve on missed opportunities. A hybrid way of working, for example, could be adopted where necessary for better productivity and teamwork.
We want to ensure that going forward we continue to be a very agile organization because we've seen the disruption that something like COVID-19 has brought.